If you're going to have a hip replacement, how do you choose who's going to do it for you? You probably know lots of people already who've had hip replacement surgery or are awaiting it. Ask them who they went to see and how they got on with that surgeon. You could ask your GP. If you're looking online, my best advice is for you to look at the National Joint Registry. This organisation documents every hip and knee replacement done in the UK and is a huge source of information about hospitals and surgeons alike. If you're looking online, beware of Dr. Google. There's lots of information out there which is not particularly reliable or trustworthy. Remember, when you're thinking about choosing a surgeon, it's not just about the person who's going to do the operation. Good surgeons work as part of an extended team of nurses, physiotherapists and management, all of whom play their part in making sure you get the best outcome from surgery. Having your surgery in a convenient location is really important. You might want to be visited by friends and family, and coming back for physiotherapy appointments and follow-up is also very important. You certainly don't want to be sitting in a car for several hours to go to a hospital 100 miles or so away. Is the surgeon readily available? Sometimes things don't go according to plan, and it's important to know that your surgeon is available to help sort out problems should they arise. People often ask me, if I were to have a hip replacement, who would I choose? Well, obviously I'd choose someone like me, a specialist high-volume hip surgeon with lots of experience and excellent training. You can find this sort of information out by looking at the surgeon's CV online or the hospital website. The National Joint Registry is also a very good source of information about surgeons and hospitals. If you know people who've had surgery under this surgeon's care, ask them what he or she is like. Are they available to deal with problems? Are they approachable? Do they have a good reputation? Think about the anaesthetist. Ask the surgeon which anaesthetist he works with and why. I've worked with the same anaesthetist for nearly 20 years and we have a brilliant professional relationship. Also think about the hospital. High volume hospitals, those which do several hundred cases a year, certainly get better outcomes than hospitals which don't do many joint replacements. I hope you found that presentation useful. If you've got any questions or comments, please do get in touch either through the website or via my secretary Anne. Her details will follow shortly. If you like the channel, please do subscribe. I'll be posting some more videos very shortly. If there's anything in particular that you'd like me to cover, please let me know. I'm Jeremy Latham and I'm the hip surgeon.